water soluble vitamins. Let us start with the introduction. Vitamins are organic substances present in small amounts in food. They are required for carrying out vital functions of the body. They must be supplied in the diet if body is unable to synthesize them. Vitamins are considered essential. The word vita means life in Latin. Their discovery often came about because of their absence in the diet. They are involved in the utilization of the major nutrients like proteins, fats and carbohydrates. Though needed in small amounts, they are essential for health and well-being of the body. Vitamins are discovered based on their function and chemical nature and were designated as A, B, C and D. Vitamins are classified based on their solubility as fat soluble and water soluble vitamins. Water soluble vitamins are not accumulated in the body but are readily excreted. In the case of a deficiency, the clinician should be able to recognize the syndrome caused by a lack of the particular vitamin. In this country of abundant and varied food supply, the individual should instead think in terms of what a specific vitamin does rather than what disease it prevents. Water soluble vitamins are members of B complex and vitamin C, which is ascorbic acid. Most of the B complex group can be further divided according to their general function as energy releasing or hematopoietic. Other vitamins cannot be classified this narrowly because of their wide range of functions. As you can see in the screen, the classification of vitamins is vitamin C and B complex vitamins. Under B complex vitamins, it is energy releasing, hematopoietic and other. Under energy releasing, it is thiamine, riboflavin, niacin, pantothenic acid, biotin and vitamin B6. Under hematopoietic, it is folic acid, vitamin B12, vitamin B6 and pantothenic acid, and other functions includes vitamins like thiamine, niacin, folic acid, vitamin B6 and vitamin B12. As you can see in the screen that there are 9 water soluble vitamins. They are ascorbic acid, thiamine, riboflavin, niacin, pantothenic acid, vitamin B6 which is pyridoxine, biotin, folate and vitamin B12. The sources of ascorbic acid are amla, papaya, orange, guava, strawberries, bitter gourd, drumstick leaves, cashew fruit, agati, cabbage and tomatoes, and the recommended dietary allowance per day for ascorbic acid is 40 mg for adults. For thiamine, the requirement is 1 to 1.7 mg, and the good food sources are yeast, whole wheat, millets, parboiled rice, sunflower seeds, legumes, gingerly seeds, groundnut, soya bean, organ meats and eggs. The good food sources of riboflavin are liver, dried yeast, mushrooms, milk, egg, meat, and the requirement is 1.1 to 2.1 mg per day. The fourth vitamin is niacin, which is called as vitamin B3, and the required amount is 12 to 21 mg per day, and the good food sources are dried yeast, tuna, liver, rice polishing, peanut, whole cereals, beef, mushrooms and legumes. Niacin is also obtained from tryptophan, which is present in the dietary protein, which can be converted to niacin. Next vitamin is pantothenic acid. The adequate intake of pantothenic acid per day for adult is 6 mg and this pantothenic acid is widespread in foods, exceptionally in high amounts in egg yolk, liver, kidney, yeast, legumes and whole grains. Next is vitamin B6, which is present mainly in meat, pulses, wheat, potato, banana, whole grains, and the required amount is 2 mg per day. Next vitamin is biotin, and the adequate intake is 30 microgram. This biotin is synthesized by microflora of digestive tract. Yeast, liver, soybean are the good sources. Next is folate. The sources are brewer's yeast, liver, green leafy vegetables, and the requirement per day is 200 microgram. The last vitamin is cobalamin, and it is present in animal foods like meat, fish, shellfish, and the required amount is 1 microgram per day. Deficiencies caused due to lack of the following vitamins such as vitamin C, thiamine, riboflavin, niacin, pantothenic acid, pyridoxine, biotin, folic acid and vitamin B12. Now let us start with the first one, vitamin C. The chemical name for vitamin C is ascorbic acid. It was discovered in 1747 by demonstrating that citrus fruit juices prevented and cured scurvy. Vitamin C functions in oxidation and reduction reactions and is synthesized from glucose and galactose by plants and most animals. However, humans and other primates lack the enzyme 1-gluconolactone oxidase and thus cannot biosynthesize the factor, which for them consequently is a vitamin. Now let us see the effects of deficiency of this vitamin. Prolonged deficiency of vitamin C produces a disease condition called as scurvy in both infants and adults. Scurvy is typically manifested when the total body vitamin C, scurvy is typically manifested when the total body vitamin C pools fall below about 300 mg and plasma vitamin C concentration drop to less than 0.02 mg per dl. Scurvy is fatal if untreated. The 4 H's like hemorrhagic signs, hyperkeratosis of hair follicles, hypochondriasis, which is psychological manifestation, and hematological abnormalities, which is associated with impaired iron absorption, are often used as a mnemonic device for remembering scurvy signs. Now let us see what is infantile scurvy. In infantile scurvy, there will be loss of appetite, failure to gain weight, irritability, pallor, defective growth of bones, hemorrhage occurs under the skin, there will be defective formation of teeth and gums will be swollen, the ends of the rib become prominent resulting in beaded appearance called scorbutic rosary. Next is adult scurvy. General manifestation are fever, susceptibility to infection, lethargy, fatigue, rheumatic pains in the legs, muscular atrophy and delayed wound healing. Next is anemia. In anemia, it is microcystic hyperchromic anemia develops due to failure of absorption of iron. Next, gums become spongy and bleed easily. Gums become swollen, ulcerated and eventual tooth loss. The blood vessels become fragile and porous due to defective formation of collagen. Joints become swollen and tender. Clinical symptoms appear when total body pool of vitamin C decreases, skin becomes rough and dry, there will be small petechial hemorrhages around hair follicles. Next vitamin is thiamine. Thiamine is known as vitamin B1. Deficiency of thiamine leads to beriberi. This condition is widely prevalent among population whose diet contains more of polished cereals. The effects of deficiency are: deficiency of thiamine is associated with low calorie intake. Severe deficiency of thiamine produces a disease known as beriberi. Beri, which means weakness. One of the first symptoms of thiamine deficiency is loss of appetite and thus weight loss. As the deficiency worsens, cardiovascular system involvement such as hypertrophy and altered heart rate and neurological symptoms such as apathy, confusion, decreased short-term memory and irritability appears. There are three types of beriberi: dry beriberi, wet beriberi and acute or infantile beriberi. Dry beriberi, it is found predominantly in older adults. Deficiency is of result from a chronic low thiamine intake, especially if coupled with a high carbohydrate intake. Dry beriberi is characterized by muscle weakness and wasting, loss of appetite, tingling, numbness and burning sensation in hands and feet. Calf muscles will become tender, knee and ankle jerks will be sluggish. In later stages, complete loss of sensation in hands and legs will occur. It is characterized by foot and waist drop. Mental depression and confusion occurs. In the case of wet beriberi, there is enlargement of heart and the cardiac output is high. Edema or accumulation of fluid in legs, face and trunk is observed. Palpitations are marked. In acute or infantile beriberi, it occurs in the first few months if the diet of the mother is deficient in thiamine. Symptoms are anorexia, vomiting, restlessness, sleeplessness, constipation, enlargement of the heart and breathlessness. Thiamine deficiency is often associated with alcoholism, Wernicke's encephalopathy or Wernicke-Korsakoff syndrome. A neurophysiological complication is also commonly found in those with alcoholism and AIDS and in those receiving parenteral nutrition, that is high in dextrose and low or absent in thiamine. People with alcohol dependency are particularly prone to thiamine deficiency because of decreased intake of the vitamin from decreased food consumption, increased requirement for the vitamin because of liver damage and decreased thiamine absorption. The Wernicke's encephalopathy is characterized by ophthalmoplegia, which is paralysis of the ocular muscles, nystagmus, which is constant involuntary eyeball movement, ataxia, which is impaired muscle coordination, loss of recent memory and confusion. The third vitamin is riboflavin. Riboflavin or vitamin B2 is the yellow enzyme which is heat stable unlike other B vitamins. Riboflavin in the combined form with proteins form flavoproteins or yellow enzymes. The effects of deficiency of riboflavin is known as arabinoflavinosis, which rarely occurs in isolation but most often is accompanied by other nutrient deficits. Riboflavin deficiency is prevalent mainly among the low income groups, particularly the vulnerable group and the elderly adults. Riboflavin deficiency becomes manifest after several months of deprivation of the vitamin. Riboflavin deficiency is characterized by soreness and burning of the mouth and tongue, lesions at the angle of the mouth called as angular stomatitis, which is cracks in the skin at the corners of the mouth. The inflammation of the tongue called glossitis is seen. Dry chapped appearance of the lip with ulcers termed chiliosis is seen. The skin becomes dry and results in seborrheic dermatitis. Photophobia, lacrimation, burning sensation of the eyes and visual fatigue, decreased motor coordination and normocytic anemia is seen. The next vitamin is niacin. The term niacin is considered a generic term for nicotinic acid and nicotinamide. The niacin is also called as vitamin B3. Niacin is required by all the cells of our body. Like thiamine and riboflavin, it plays a vital role in release of energy from carbohydrates, proteins, fat and alcohol. Like thiamine, which was discovered through its deficiency disorder beriberi, niacin was also discovered through the condition pellagra in humans and a similar condition called black tongue in dogs. Now, let us see the effects of deficiency of niacin. Deficiency of niacin causes a disease known as pellagra. It is characterized by 3 Ds, which is dermatitis, diarrhea and dementia. Dermatitis, the name pellagra comes from pelle, which is skin, and agra, which is rough. Marked changes occur in the skin, especially in the skin exposed to sun and friction areas like elbows, surfaces of arms and knees. Lesions are symmetrically distributed in the affected parts. At first, there is reddening, thickening and pigmentation of the skin. Later on, there is exfoliation leading to ultimately parchment of skin, butterfly like appearance. Next is diarrhea. Diarrhea enhances the deficiency state. There are structural and absorptive defects in the small intestine. Tongue appears raw and mucous membrane of the tongue is inflamed. Gastrointestinal manifestations like glossitis, chiliosis, stomatitis, nausea, vomiting and diarrhea or constipation is seen. In dementia, there is irritability, depression, poor concentration and loss of memory. Delirium is a common mental disturbance. Next vitamin is pantothenic acid. Pantothenic acid consists of beta alanine and pantoic acid joined by a peptide bond or amide linkage. The vitamin was once called as vitamin B5. The effects of deficiency, burning feet syndrome is characterized by numbness of toes and a sensation of burning in the feet. The condition is exacerbated by warmth and diminished with cold and is thought to result from pantothenic acid deficiency. Other symptoms of deficiency include vomiting, fatigue, weakness, restlessness, and irritability. Deficiency of pantothenic acid is thought to occur more often in conjunction with multiple nutrient deficiencies, as for example in malnutrition. Some conditions that may increase the need for the vitamin include alcoholism, diabetes mellitus, and inflammatory bowel diseases. Increased excretion of the vitamin has been shown in people with diabetes mellitus. Next vitamin is pyridoxine. Pyridoxine is unique among B complex vitamin in that it functions primarily in protein metabolism. Pyridoxine denotes related substances such as pyridoxine, pyridoxal, and pyridoxamine are three forms in which it is present in our body. Pyridoxine represents the alcohol form, pyridoxal the aldehyde form, and pyridoxamine the amine form. Some of the initial research was aimed at correcting dermatitis in rats. The effects of deficiency of this vitamin leads to abnormalities in protein metabolism, which is manifested as poor growth, conversions, anemia, and skin lesions. Severe deficiency leads to microcytic hypochromic anemia. Symptoms such as weakness, nervousness, irritability, insomnia, and difficulty in walking is predominant. Deficiency also alters calcium and magnesium metabolism, impairs niacin synthesis from tryptophan, and inhibits metabolism of homocysteine. The last results in hyperchromocysteinemia, a risk factor for heart disease. Groups particularly at risk for vitamin B6 deficiency are the elderly who have a poor intake of the vitamin, people who consume excess amounts of alcohol, and people on a variety of drug therapies. Next vitamin is biotin. Biotin's discovery was based on the research investigating the cause of what was called egg white injury. Eating raw eggs was known to result in hair loss, dermatitis, and various neuromuscular problems. In 1931, a substance was found in liver that could cure and prevent the condition. Biotin was once called vitamin H, in which the H refers to hot in German, which means skin, and also it is called as vitamin B7. The effects of deficiency of biotin in humans is characterized by lethargy, depression, hallucinations, muscle pain, paresthesia in extremities, anorexia, nausea, alopecia, which is hair loss, and scaly red dermatitis. A diet devoid of biotin can result in decreased plasma biotin and in reduced biotin excretion in about 2 to 4 weeks. Biotin deficiency or poor biotin status, though fairly rare, occurs in various populations. People who ingest raw eggs in excessive amounts are likely to develop biotin deficiency because of impaired biotin absorption. Impaired biotin absorption may also occur with gastrointestinal disorders such as inflammatory bowel disease, and aclohydria, which means lack of hydrochloric acid in gastric juices in people on anticonvulsant drug therapy or in chronic consumers of excessive amounts of alcohol. Biotin status has been shown to decline in some women during pregnancy. Next vitamin is folic acid. Folic acid is the term used to refer to the oxidized form of the vitamin found in fortified foods and in supplements. Folate refers to the reduced form of the vitamin which is found naturally in foods. The Latin word folium means leaf and the word folate from Italian means foliage. Folic acid was first extracted from dark green leafy vegetables. Folates and vitamin B12's discovery resulted from the search to cure the disorder megaloblastic anemia, a problem in the late 1890s and in early 1880s. As with many of the other vitamins, eating liver was shown to cure the condition. The effects of deficiency: some folate deficiency results in the bone marrow producing immature cells and few mature red blood cells. This results in reduced oxygen carrying capacity, causing anemia termed megaloblastic anemia. Folate deficiency during pregnancy causes neural tube disorders of the fetus. Folate deficiency impairs the ability of the immune system to fight infections. The last vitamin is vitamin B12, which is cyanocobalamin. Vitamin B12, also called cobalamin, is considered a generic term for a group of compounds called carotenoids because of their carine nucleus. Vitamin B12 was the last vitamin to be discovered. It was isolated in 1940. Eating large amounts of liver could help correct pernicious anemia associated with deficiency of this vitamin. It took about 2 decades to identify the vitamin in the liver. Now let us see the effects of deficiency. Pernicious anemia is the major problem arising from an inadequate amount of vitamin B12. Pernicious anemia is a condition characterized by very large immature red blood cells with normal amounts of hemoglobin. Most deficiency signs and symptoms are of neurologic and hematologic origin. Some signs and symptoms include skin, pallor, fatigue, shortness of breath, palpitations, insomnia, tingling and numbness, abnormal gait, loss of concentration, memory loss, disorientation, swelling of myelinated fibers and possibly dementia. Neurological problems occur in about 75 to 90% of deficient people. Now let us conclude the session. Vitamins are required for carrying out vital functions of the body. Though needed in small amounts, they are essential for health and well-being of the body. Vitamins are classified based on their solubility as fat soluble and water soluble vitamins. Water soluble vitamins are members of the B complex and vitamin C. Deficiency of vitamin C produces a disease condition called as scurvy. The 4 H's, which is hemorrhagic signs, hyperkeratosis of hair follicles, hypochondriasis, hematologic abnormalities, are often used as a mnemonic device for remembering scurvy signs. Deficiency of thiamine leads to beriberi. There are 3 types of beriberi and they are dry beriberi, wet beriberi and acute or infantile beriberi. A deficiency of riboflavin is known as arabinoflavinosis and of niacin is known as pellagra. Pellagra is characterized by 3 D's, which is dermatitis, diarrhea and dementia. Pantothenic acid deficiency leads to burning feet syndrome and characterized by numbness of the toes and a sensation of burning in the feet. Vitamin B6, I repeat, vitamin B6 deficiency leads to abnormalities in protein metabolism and microcytic hypochromic anemia. Biotin deficiency in humans is characterized by lethargy, depression, hallucinations, muscle pain, paresthesia in extremities, anorexia, nausea, alopecia and scaly red dermatitis. Folate deficiency causes megaloblastic folate deficiency causes megaloblastic anemia, while pernicious anemia is caused due to vitamin B12 deficiency. Thank you.